microbes, like bacteria and viruses, naturally build shields against medicines that kill microbes. This is called antimicrobial resistance, AMR. People who use drugs or do not properly manage infections often develop AMR. A lot of AMR is caused by bacteria that no longer react to antibiotics. An infection caused by AMR kills millions of people every year, and medicines that work require stronger drugs and cost more. People should only take antibiotics when their doctor tells them to. Use narrow-spectrum antibiotics and keep the number of infections that become resistant to medicines low. All over the world, AMR is rising because more antibiotics are being administered and given out in developing countries. This is very bad for people's health. Before you begin watching the video, please subscribe and leave a comment to show your support. Let's start. Antibacterial resistance means that a germ can't be killed by a medicine used to treat illnesses. It can be divided into microbiology and medicine categories. Genes that have been changed or passed down cause microbiological resistance. Genes that move from one place to another cause clinical resistance. Resistant antibiotics are very bad for public health. They happen everywhere and affect people of all ages and from everywhere. Children younger than 5 were 1 in 5 of the 1.27 million deaths around the world in 2019. Resistance to antibiotics is mostly caused by using too many of them or not treating them properly. This can lead to the development of drug resistance genes or the spread of naturally resistant types. Medication abuse and overuse have made the problem worse. Many medications have become unnecessary. Antibiotics were already becoming less effective in animals before they were used on people. This happens when living things come into contact with antimicrobials. Through horizontal gene transfer, microbes that do not cause disease can pass on their protection to microbes that do. This implies that the germ killer is unable to eradicate the majority of bacteria. And a big reason why drug resistance is rising is that people take antibiotics on their own, which happens a lot in places with few resources. It's possible for people who do this to stop being affected by bugs. In low and middle-income countries, people are more likely to treat themselves when they are not in the hospital. This means that they use more drugs. Additionally, individuals often lack knowledge about when to seek medical advice or the potential risks associated with certain medications. Antimicrobial resistance can also be caused by healthcare workers misusing antibiotics when they are not needed or for the wrong reason. More drugs are being used because of COVID-19, which could make the health problems around the world worse. Disinfectants such as antiseptic hand wash and alcohol hand sanitizer may also increase antimicrobial resistance. Hospitals, clinics, and drug companies that pollute the environment can expose microbes to antibiotics, causing tolerance to grow. Antimicrobial resistance is also a problem in the food business, especially when it comes to animals that are raised for food. Overuse of medicines can alter germs, rendering them immune to their killing effects. As a result, this can end up in the food that people eat. The World Health Organization's Advisory Group on Integrated Surveillance of Antimicrobial Resistance strongly advises that medically important antimicrobials should not be used on cattle in large amounts and should not be used to help animals grow or keep them from getting sick. Microbes are becoming immune to pesticides because they are used too often. Pesticides keep plant and animal life out of crops. Bacteria from the past that have been found in permafrost have many genes that make them not respond to many popular antibiotics, but they aren't as tough as the germs that are already in the area. Antibiotic resistance is a problem that is getting worse all over the world. The public wants everyone to come together and fix the problem. Some people have suggested a system that would keep track of places around the world where there is a lot of resistance. This knowledge could then be used to guide programs and interventions. Delaying or limiting antibiotic use for some diseases is a safe way to cut down on antibiotic use. There are currently no national or international programs that deal with antifungal resistance. However, initiatives such as Resistance Open monitor drug-resistant risks. Antimicrobial care programs teach people how much of an antibiotic they can use, which can help reduce the number of cases of resistance. Get the right antibiotics for your infection with the help of the World Health Organization guidelines and antibiotic book. Diagnostic tools can help you avoid using too many medicines. Hospital antimicrobial stewardship teams encourage people to use antibiotics in the best way possible so that they aren't misused and resistance doesn't grow as much as possible. More and more people are not responding to antibiotics, and in some countries like the Netherlands, Germany, and Sweden, the number of antibiotic prescriptions is declining. By giving parents written information and making sure they have enough time to talk to the doctor, primary care settings can cut down on giving medicines that aren't needed. To help fight antibiotic resistance, doctors and chemists should use the right medicines, stop and treat infections more effectively, and only give antibiotics when they're really needed. To assist, individuals should only take antibiotics as prescribed by their doctor, ensure they complete their entire prescription, refrain from sharing antibiotics, and attend educational sessions on preventing infections. To stop drug resistance, we need better places to clean up, get water, and practice good hygiene. There are ways to treat industrial wastewater that can lower the amount of residue that ends up in the environment. Cutting down on the use of antibiotics on farms and in animals can help lower the number of food animals that are immune to them. Some places, like Europe, have limited the use of antibiotics in a way that doesn't hurt business or the health of animals. Global health is at risk because of antimicrobial resistance. Antacids are mostly used on farms in the US, with only 70% being used for medical reasons. The FDA was the first to notice in 1977 that animals were spreading germs that couldn't be killed by medicines. A World Action Plan was agreed upon at the 68th World Health Assembly in 2015. Its goal is to improve antimicrobial resistance education, training, and information so that more people know and understand it. The World Health Organization published the Bacterial Priority Pathogens list for 2024. It has 15 groups of bacteria that can't be killed with medicines. The UN's Interagency Coordination Group, IACG, on antimicrobial resistance has also given member states 5 ideas for how to deal with the growing threat of drug resistance. Antibiotic resistance can happen in 5 main ways. The drug is turned off or changed, the target or binding site is changed, the metabolic path is changed, the drug doesn't build up as much, and ribosomes are broken up and reused. In terms of death rates, Escherichia coli, Staphylococcus aureus, Klebsiella pneumoniae, Streptococcus pneumoniae, Acinetobacter baumannii, and Pseudomonas aeruginosa are the 6 bacteria that cause the most deaths. Some bacteria, such as gram-negative bacteria, cannot be killed by certain medications. Drugs can no longer work on some bacteria because their genes have changed or been passed from one bacterium to another. It is also possible to introduce resistance in a lab setting using various techniques. A recent study demonstrates that the emergence of resistant bacteria does not necessarily require a large number of them. Sometimes only a few bacteria can become resistant. Carbapenemices like New Delhi metallo-beta-lactamase 1, NDM1, have become a major health disaster as they appear and spread. It has become very dangerous for people to be around carbapenemices like New Delhi metallo-beta-lactamase 1. HIV, hepatitis B, hepatitis C, the flu, and herpes are just a few of the diseases that antiviral drugs are used to treat. Some types can no longer be killed by the drugs, though, because the genes that code for those proteins have changed. Antivirals for HIV don't always work, and new types have been found that are resistant to more than one drug. Using a mix of drugs has helped keep the problem under control, but new drugs are needed because HIV types that are not easily killed are growing. It is very dangerous for people who don't have strong immune systems to get infections with fungi like Candida, Cryptococcus, Neoformans, and Aspergillus fumigatus. Antifungal resistance is a problem that One Health is worried about. It can happen because of changes in the climate, host factors, and the long-term use of fungicides and therapeutic antifungals. It's scary that Candida auris is becoming more and more known as a possible human disease. Antibiotic use in the UK dropped by 9% between 2014 and 2018. This shows that drug resistance is getting worse. In the US, more than 2.8 million cases of illnesses that are not fixed by antibiotics have been reported. All told, though, deaths from these infections dropped by 18%, and both hospital-acquired illnesses and deaths dropped by 30% in 2019. Because of the COVID outbreak, antibiotic resistance has grown. This means that more drugs are being used, making diseases more resistant. Additionally, there is a dearth of information on strategies to prevent this trend. The years between the 1950s and 1970s, when antibiotics were first discovered, were a difficult time because germs are very strong and antibiotics are often misused or overused. Because of the COVID pandemic, progress in lowering drug resistance has been lost. As a result of the COVID pandemic, the use of more medicines has increased, leading to the emergence of more resistant diseases, and we are unsure of how to halt this trend. To stop antibiotic resistance and make sure that antibiotics are safe and efficient, we need policies that encourage innovation, laws that make sure they are followed, and reviews of policies. Antimicrobial resistance, AMR, needs to be stopped quickly, and medicines need to be used properly. This can only be done with quick diagnostics and tests. Tests that measure how well antibiotics work help doctors give better and more precise drugs. It is possible to do quick tests during an 8-hour shift, and AMR genes can be found in many cases. As time goes on, visual techniques and genetically based methods for describing AMR are being used more and more to find it. Rapid diagnostic methods have also been tried as a way to change the causes of AMR in healthcare and improve antimicrobial stewardship. Even though vaccines work most of the time, microorganisms can sometimes get through them because everyone's immune system is different and antibodies don't last long. Alternating treatment involves taking multiple antibiotics back and forth. It gets rid of germs that one drug can't kill. Tests done in the lab show that this method lowers drug resistance. On the other hand, large-scale lab and clinical tests haven't found much proof that drugs can move from one pathogen to another. Antibiotics are getting less research and less money, which could mean a crisis for the pharmaceutical industry. Small and medium-sized drug companies, however, are still researching antibiotic drugs. The way that new antibiotics are found and made has changed because of the work that is being done with public and private money. Coming up with new medicines is the job of the European Medicines Agency, EMA, and the Food and Drug Administration, FDA. Because they have money problems, they're coming up with new ways to make drugs and pay for them. New drugs that kill fungi are being made and will be tested on people in 2021. People are using biomaterials, high-tech computer tools, and closely monitoring the computer community to combat antibiotic resistance. In phage treatment, biogenic phages, which are found in nature, are used to treat infections caused by harmful bacteria. It could be used in gardening, surgery, medicine, and animal research. It is now possible to make bacteriophages that can fight illnesses caused by germs that are not easily killed with drugs because genetics and biotechnology have come a long way. What do you think? Write down in the comments. See you in the next video.